Welcome back to another episode of Mind, Your Body, and Soul. I am Joseph Ward. Sadly, I'm flying solo today. We have a lot going on in that neighborhood, and we'll tell y'all all about the wonderful stuff we got going on later. But my co-host Mathias Sweet couldn't be here, but we want to give him some love and shout out for all that he does, and also we make sure we shout out Ian Costello and Miss Alana Steaple for all the work that they do on the podcast. So thank everybody, and thank all of our viewers and our listeners. The love and the support has been great. It's been overwhelming, and we appreciate everybody who's tuning in to what we're doing here at Mind Your Body and Soul, the healthiest podcast. And remember, Mind Your Body and Soul is an educational podcast that focuses on all things health related to help our listeners learn about the various health topics and information they may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of themselves. And Mind Your Body and Soul is available on our website at www.nmcpodcast.com. Also, our parent website at www.neighborhoodmedicalcenter.org. You can also find us on Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts, as well as this YouTube channel. So make sure you like this video, comment, subscribe, and share it with a friend, because I'm sure, I know for a fact, today's information is helping everybody. So we have a great interview today. We have a great conversation. We here at Neighborhood Medical Center, we pride ourselves on being able to build relationships with other people in the community, other organizations in the community who are serving not just the people we're serving, but the community as a whole. And we're able to build a relationship with Tallahassee Memorial Hospital. And that has led us to this wonderful interview with Sonnie Mayweski of the memory. I know I'm messing it up, but Memory Disorder Unit. Did I say it right?
Memory Disorder Clinic, yes.
Okay, the Memory Disorder Clinic for TMH, and we're going to learn more about TMH. We're going to learn more about Sonnie, and we're going to learn more about the memory disorders. So, welcome, Sonnie. Welcome to Mind Your Body and Soul.
Thank you so much for having me.
Oh, no problem. Thank you for being here. We're always excited to have someone come give their time and give information to help our audience, and we're just overwhelmed about it by it, and we thank you for all that you do.
Oh, absolutely.
So let's get into it. Let's get to know each other. So give us some background information about yourself and just overall what got you started in the whole realm of healthcare.
Sure. So born and raised in Tallahassee, so I am a local.
Yes.
I earned my bachelor's degree in psychology and my master's degree in social work, both at FSU.
Okay.
And during both of those programs, I had the opportunity to take part in some internships and some volunteer opportunities that were in the healthcare field. And I really just enjoyed my time, fell in love with it, and kind of decided to continue with it and pursue it as a career.
Okay. So couple things in common. I am a native of Tallahassee. I also studied, my undergrad is in psychology, so similarities there. Okay. And moving into the realm of healthcare. So when you were young, you're a high school student, you're trying to figure out life. Was healthcare part of that mix, or just, as you matriculated through life and as you learned more, that's when you kind of got more information about it?
Yeah, it's so funny how, everyone's kind of career plans change as they experience different things. I always leaned towards the nursing field, the field of nursing. And then kind of as I learned more about different roles in healthcare, I really found out that social work was the way to go for me, to be able to help families, help connect them with resources and information, and so they can continue to live a good, long life and meet whatever goals they might have with their life.
Okay. And another thing you just kind of sparked in my mind as you were saying that, most people don't equate social work as part of healthcare. Most people think social work is like just a social service or something, or they look at it like psychology, even though there is a part of health as mental health. But can you kind of help people understand why social work is a part of the healthcare field?
Sure, absolutely. So we're able to help, and I can speak kind of specifically to the memory disorder clinic. We give families education on, ways to maintain their daily lives, their daily routines as much as possible. We help caregivers a lot with caregiving for their loved one, but also taking care of themselves. And we connect people with a lot of community resources. So social workers tend to be really well connected and kind of know what's out there. And if we don't know something directly, we can usually point people towards someone who does.
Right. Thank you for that, because social workers are definitely vital in the community. And when you meet a great social worker, you got to hold on to them.
Oh, absolutely. Thank
Yes.
you.
Yes. So background in social work, background in psychology, had an interest in nursing. So how did all that lead to you transitioning into working into brain health and the memory disorder clinic? How did you come about being a part of the memory disorder clinic for TMH?
Yeah, so I've always been kind of fascinated by neuroscience and the brain and kind of how it works and how it, we don't ever really think about how our brain works. It's just kind of there and helps us do our everyday things. So during my first internship in grad school, I was able to intern here at the Memory Disorder Clinic.
Okay.
Really enjoyed it, learned so much about the field. It was a really valuable experience. And then after I graduated, I joined the team here as the clinical social worker. So really kind of doing a lot of work with the patients and their families. And then back in last September, I transitioned to the role of the memory disorder clinic coordinator. So I do a lot of these educational opportunities where I talk to the community. I do a lot of trainings for professionals in law enforcement, healthcare, things like that, on working with people who are affected by dementia and their families. And then I also do some grant and budget management because we're one of 17 memory disorder clinics in the state of Florida. We're funded by the Department of Elder Affairs. So I kind of do some of that management side of things now as well.
Okay. But I'm sure it's because, like you said, you already had an interest in like the brain and how it works and human behavior and things. But I'm sure this deepens your interest in the brain, understanding like the different ways it works, the way it can repair itself, but also giving more insight in things that can damage the brain as well.
Right, absolutely. I still learn new things every day. I've been working in this field for about 5 years, and I still just about every day learn something new.
Right. And it's for me, it's amazing how, like you say, we can't do anything without our brain, but oftentimes that's the last thing we learn or we look to learn about or even explore is the brain. It's so fascinating to me. So that's interesting, and that's another reason why I'm excited for this. We get to learn more about the brain.
Yeah, absolutely.
Right. So I just learned this myself that June is Brain Health Month. So that's good for us. What we do because we're focusing on mental health, but we never focus on the brain. So it helps us go broader with that. But could you help us understand more about brain health? Like, what is brain health, and why would you say people should focus more on brain health rather than just physical fitness or any other type of health?
Yeah, absolutely. So they're kind of all linked together. So we think a lot about heart health and physical health and mental health, and those all have an impact on the brain as well as kind of in the other direction. So, not a lot of people pay special attention to their brain unless it's kind of causing them issues.
Mm-hmm.
That's start to think about it. But, we only get one brain ever in our lives. We can get a liver transplant if we need one. We can't get a brain transplant. And, brains tend to not be very good at healing from damage, whether that's from an injury or a disease, a disorder, or even, things like poor blood flow can cause issues with our brain. And our brain really isn't that great at healing and reversing that kind of damage. So it's really
Okay.
important that we, think about our long-term quality of life, what we want for our future and our later years, because how well we take care of our brain throughout the spectrum of our entire lives is going to have that impact. I tell people you're never too young or too old to start kind of thinking about these things that take good care of your brain.
Right. Okay. So like another part of the body could possibly heal faster from an injury. So I break my leg and I have some kind of injury to my brain. the leg would heal faster and maybe stronger than the injury to the brain.
Right. And we can often, if there is an injury or damage to the brain, there are things we can do to compensate for that.
Mm-hmm.
But as far as kind of reversing that damage or replacing those brain cells, we do start to lose brain cells around 30 years old.
Okay.
And we don't generate new ones.
Okay. Oh, I got you. I got you. That makes sense. So if you're already losing brain cells and something happens that could possibly contribute to more brain cells, it wouldn't be anything to help repair those brain cells.
Right.
So have you ever read or heard about or seen any studies or anything that someone is doing to help regenerate brain cells or repair brain cells?
There is some research out there. As far as dementia research goes, they have not yet found a way to repair damage that's already done. They found some treatments to slow the progression of someone with a neurodegenerative disease, so dementia, like an Alzheimer's or something like that, to kind of slow that progression. But the research isn't out there yet on reversing or replacing that loss.
Okay. Now it's interesting though, because as we're talking, I'm imagining myself like I'm back in high school or middle school in the class, and we're talking about the brain, and they showing everything like we're on the magic school bus or something. So in my mind. So what are some factors that would lead to a decline in brain health or brain function?
Sure. So a big one is those chronic health conditions. So things like diabetes, high blood pressure, high cholesterol,
Wow.
obesity, those all have an impact on brain health. There are neurodegenerative diseases. So like I mentioned, Alzheimer's or other types of dementia. And that's why those lifestyle changes and healthy habits are so important. We talk about what are called modifiable risk factors. So
Right.
people have different risk factors for different diseases, and there are some of them that we can't control, some of them that are genetic that we can't really do anything about. But these modifiable risk factors are things that we can change about our lifestyles, about our habits, to kind of help protect us and hopefully prevent us from developing dementia. So things like that might be incorporating more physical activity into our lives. It's not smoking. So if you do smoke, try and quit. If you don't smoke, don't start. Things like staying socially and mentally active.
Right.
Attaining as much education as you can. That tends to be a protective factor. And then, things like managing your blood pressure and heart health and maintaining a healthy diet. So we usually recommend the Mediterranean diet, which is things like leafy greens, healthy fats, fish. So.
Okay. So I didn't. Okay, you're blowing my mind a bit. All right, because I'm thinking I know. Because I read a lot, but I know I don't know it all. But I'm thinking I have. Well, I should say I'm thinking I have an idea. So my lack of physical health and my lack of care for my body affects my brain, and I get it, but just saying it, making sure it sticks. So if I don't exercise on a regular basis, that could lead to a degeneration in brain function.
Right, absolutely. And I always tell people, so people kind of tend to say, oh, well, that means I have to run a mile every day. If you don't like running and you tell yourself you're going to stick to that habit, it's going to be a lot harder to keep yourself accountable and stick to that habit. So kind of find something you enjoy. Find a way to incorporate exercise that you're going to look forward to and you're going to be more likely to engage in. Is going to make it a lot more likely that you'll stick to that habit.
Right. Okay. And so you also talked about the diet. So I know I'm a big fan of walnuts. I got a big bag of walnuts on my table now. I know blueberries are good antioxidants, but what foods would be recommended that people consume that could help improve brain function or even help diminish degenerative things that happen to the brain?
Yeah, so we talk a lot about the Mediterranean, or it's sometimes called the Mediterranean DASH diet. So, you're right on board with the walnuts. Those have those good, healthy fats. You want omega-3s, so things like salmon. And then those good leafy greens. Generally, olive oil is what's used in the Mediterranean diet,
Right.
fish, so salmon. So those are probably the big three are the foods high in antioxidants and berries
Right.
you mentioned, those leafy greens, and then healthy
Okay.
fats.
Right. And then what? So a healthy diet that's balanced with making sure you have the right foods. And so you said smoking could contribute to some of the degenerative factors. What about alcohol consumption?
So generally, it's recommended in moderation. The research is a little mixed on this, but some does suggest that 1 glass of red wine a day can help promote good brain health. Of course, that is in moderation, and they wouldn't necessarily recommend if you don't already drink to add that into your diet.
Right. Right.
But yes, all things in moderation, absolutely.
Okay. So and I might be getting ahead of myself with the questions, but it's on my mind now. Um, are there any environmental factors that can lead to some kind of disorder to the brain? Because I see, and I ask that because I see in my community people with treated mental disorders. But in my question, I'm always wondering if the person hasn't, is it, if the thing isn't like genetic or anything, are there environmental factors that could cause a person to develop some kind of brain disorders or even memory disorder?
Yeah, absolutely. So I'm not necessarily an expert in this, but
Okay.
I do know certain things. Lead consumption. So if someone's got lead in their environment,
Hmm.
that can cause not necessarily a neurodegenerative disorder, but problems with memory, which is why it's so important to kind of maintain your doctor's appointments and maintain your health in general if you are noticing those symptoms. So those things can be ruled out because some of these things we can change about our environment.
Right. Okay. All right. All right. Thank you. So this next one is a three-parter.
Sure.
All right. So I'll give it to you one at a time. So help us understand, like the definition of what is a memory disorder.
Sure. So normally we'll use the term dementia, which is an umbrella term for different things like Alzheimer's, Lewy body dementia, frontotemporal dementia. So it's kind of a catch-all, similar to the word cancer, can refer to a lot of different things.
Okay.
But really, the term dementia is kind of a definition for a collection of symptoms. So, changes in memory, changes in cognition, changes in processing speed. So someone can have dementia without necessarily having Alzheimer's or any of the other specific forms that I mentioned.
Okay. Okay. So I'm glad you cleared that because I was thinking dementia and Alzheimer's were similar but different. But Alzheimer's is a form of dementia.
Right, exactly. And it's really, so dementia is really, it's a persistent and continuous change in memory and cognition that affects your daily life. So,
Okay.
it's happening over and over again. It's really having a profound impact on daily life.
Okay. All right. So the memory disorder is and you, just to make sure I'm clear, the class of memory disorders would be under dementia.
Right, exactly. I think that
Gotcha.
they're pretty interchangeable.
Okay, gotcha. Okay. So what causes dementia?
Wow. So it can be caused by a lot of different things, and that's why, again, it's so important to see your doctor. So,
Hmm.
things like stress, lack of sleep, mental illness, medication side effects, substance use, even some hormone and vitamin imbalances can kind of cause those symptoms. So, you want to talk to your doctor so they can rule out those other things. And then it can also be caused by a neurodegenerative disease like
Right.
Alzheimer's, like Lewy body dementia.
Okay. And you say Lewy body dementia?
Mhm.
What type of dementia is that?
Sure. So we think of Alzheimer's as people who have plaques and tangles in their brain. Lewy body is another form where people have these kind of objects called Lewy bodies in their brain, and that's what ends up impairing the functioning. So there's often hallucinations that come with it as a big marker of that Lewy body dementia. It's sometimes confused with Parkinson's dementia. There's a lot of overlap in the symptoms.
Okay. Okay. And so let's say I'm a person who hasn't had any diagnoses or anything. How would I start to be able to recognize the true symptoms or signs of memory loss rather than me just having a day where it's a lot on my mind and I just forget this or forget that? Or how do I know that, okay, this is a patternized behavior of me not remembering things?
Sure, absolutely. And there is some cognitive changes that are typical with aging. So, going to the grocery store, you're looking for a spot, you're thinking about what do I need to get, what's on my list, oh, I have to remember this. You get your groceries, you come out to the parking lot, and you can't remember where you parked. That's pretty typical. But if on the way home from the grocery store, that you go to all the time, you kind of get lost and forget how to go home, that's a little more concerning. Things like, we all have had that tip of the tongue moment where we're trying to think of a word and we can't come up with
Right.
can't come up with it. But when that's happening more and more often, or you're having a hard time naming familiar objects or following conversations, that's a little more concerning. And then often the first sign a lot of people see is poor judgment, especially with money. So maybe, investing in an odd investment that's maybe a little risky, or forgetting to pay several bills.
Right.
That's when it really gets to be concerning. And the key to all of this is change. So, we'll ask people, are you having any trouble balancing your checkbook? And they'll say, oh, I've always been really bad at math. So, that may not be a change. So really that's the key. And then also kind of asking your family members, and that's hard. It's a big step to take to say, your husband, your wife, your children, like, hey, have you noticed anything?
Right.
But sometimes those people outside of us, they're able to make, much more informed kind of decision and say, I have noticed a couple of things, Mom. I'm a little worried, I think you might need to take a trip to the doctor.
Right. Right. So do you find it difficult for people to accept that they have memory disorders, or is there a lot of resistance to, like, nothing's wrong with me, I'm fine?
It can be, and sometimes that's because we value our independence so much, and people get a little bit scared. They think, if I have this diagnosis, what's going to happen? And then also, one of the really unfortunate symptoms of a lot of types of dementia is that people aren't aware that they actually have a problem, which is why, if you have a loved one who's you're noticing some changes, some issues in their thinking and memory, that you approach it delicately, approach it from a place of, I care about you, I want you to get this checked out.
Gotcha. Okay. So my other question is, memory disorders, we know there are issues with the brain, but could that also be an indication of something going wrong in other parts of the body that's also connected or associated with your memory?
Sure. So heart health and brain health are really closely linked. But sometimes people who have dementia, a lot of the times there'll be problems with vision. So specifically with things like depth perception, they may be falling a little more often, maybe kind of bumping into things. And so also movement, so awareness of their body in space, of, kind of where their body is, where the chair is to sit down in it. And things like that. There are also some issues with autonomic functioning, which is kind of that part of our functioning that we're not really aware of. So temperature, regulating our temperature, sometimes incontinence or constipation, dizziness, fainting, our sense of smell. And a lot of those do come, later on down the road, after someone's a little further progressed. But yeah, definitely we would see it in other parts of the body as well.
That's I'm glad I asked that, and I'm glad you answered that the way you did, because I was just, it was more of a curiosity. I wasn't sure. Because I know the body is connected, all different parts of the body is connected, but I wasn't sure about the extent of it. So because you're making me think now. Like my mind is mind explosions everywhere because I'm around elderly people a lot. And so now I'm just thinking, but you can saying it could affect motor skills.
Right, absolutely.
And wow, I didn't know that. Like
Absolutely.
not
Also,
only go ahead, I'm sorry.
I would say also things like reaction time. So a lot of times we'll notice with driving, someone may not, there's so many things involved with driving that we don't think about with peripheral vision and divided attention, but also things like reaction time and seeing, oh, that light's red, I should probably stop. So being able to, get that information through our eyes, into our brain, and then make our foot do what it needs to do. So,
Right.
it's just another way
Okay.
it's kind of
So it could slow down cognitive abilities. That's
absolutely.
that's amazing. But see, this is why Brain Health Month is important. So we can
Yeah.
learn these things. Because like I say, I I do research and I'm no expert in the brain at all. But I do my fair share of reading. But I always like to engage in these conversations because you're going to learn more, and I know our audience is learning more now. So just thank you for the way you're giving the information because it's understandable, but it's just mind blowing as well.
Yeah, absolutely. A lot of people too think about dementia or memory disorders as just our memory, but you
Right.
were right on board when you talked about cognitive functioning because it's so much more to that. It's, attention and processing and executive functioning, which is kind of the planning, problem solving, decision making,
Hmm.
prioritizing
Hmm.
part of our cognition, communication, things like that. So it's more than just memory. It's
Right.
so many other factors.
Right. So um I guess kind of a percentage you don't have. I'm not expecting you to be 100% on it, but what percentage of the population would you say would deal with something like dementia within their lifetime?
So because dementia is so broad, that's a little more difficult to pinpoint. But Alzheimer's is the most common form of dementia, and about 1 in 9 people 65 or older have Alzheimer's.
Okay. Okay. So how often have you seen cases of people with dementia 65 and younger?
That's a little bit less common. There is an early onset Alzheimer's. We don't too often see them here at the clinic, but it definitely is something that people should be aware of. And that
Hmm.
early onset Alzheimer's is the one that has the strongest genetic component.
Okay.
So that's the question I get all the time is my grandmother, she had dementia when she was in her 80s. Does that mean I'm going to get it? And the likelihood of that later onset dementia being genetic is a little bit lower. So
Right.
being aware if you are younger, and you have a parent, a grandparent, an aunt, an uncle who had that early onset dementia in their 50s, it's a good thing to be aware of that and kind
Okay.
of talk to your doctor.
Okay. So and with early onset, you saying that being more genetic, so that would environmental factors wouldn't be something you would look at for early onset. You will more so begin looking at the genetics of the person.
So genetics are very important. We would also take a look at environmental and lifestyle factors just
Okay.
because, there's a lot of things that can cause those symptoms. And if it's something that we can rule out, something we can change, then we want to go ahead and do that.
Okay. So for I guess the factors for early onset will be this. Would they be similar to the factors of um, a dementia that a person would get at 65?
Um, so they would, often show up the same way. Early
Okay.
onset does tend to progress a little bit quicker.
Okay.
So if someone were to come into the clinic and they're, 45 years old, we would do pretty much the same workup as we would with someone who was 75, just to kind of make sure we're on the right track and we're
Right.
going down the right
Right.
path.
I got you. I got you. But it's just in certain people, it could just occur earlier.
Right, exactly.
Got you. Okay. All right. So this is so fascinating. It's like I'm loving this. So let's say we have different cultures, different races, different ideologies, all these different things, different genetic makeups. But let's stick with the cultures. So do people, I guess, would the memory disorders affect people differently from the different cultural backgrounds or the different racial backgrounds? Does that occur?
Not necessarily, not that I'm aware of. The prevalence does vary a little bit across different races and cultures, and of course, the family approach is a little different. So, some cultures do value more highly keeping the person in the home, really the family as
Right.
caregivers, whereas others might be more likely to make that move into an assisted living facility or a long-term care facility.
Mm-hmm.
So, kind of the individual family's approach to the diagnosis might be impacted by their culture.
Gotcha.
But, really what we kind of look at is the prevalence of dementia in across different races and cultures.
Okay. Okay. And we preach prevention a lot. Um, so we know that there are biological factors that can lead to it, but there are things that people can do to keep themselves as healthy as possible to do their best to prevent it. And so goes into the next question of um, helping to stay healthy as possible. So I know we talked about exercise, we talked about diet, but so we're also in a day and age where affirmation, 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 social media, affirmation, affirmation. So what are some other things that people can do outside of exercise and diet that could help prevent memory disorders?
So staying socially engaged is important. I know we're kind of having a tough time with that right now with this pandemic. But really meeting up with your friends as much as possible, joining a club, so something you're passionate about, joining a group or a club for that, using your brain. So, that's another one of those things people say, oh, I have to do a crossword every single day to keep my brain healthy. It doesn't necessarily have to be that. If you like working with your hands and you like building things, that's a really great way to engage your mind. If you like, numbers, Sudoku might be a better option. So keeping socially active, keeping cognitively active. FSU has some good lifelong learning classes that they have. The senior center is starting to open back up, and they have some good ways that you can stay, socially and cognitively engaged. Learning a new language. There's all kinds of apps now for kind of learning a new language, and they help you pace yourself on that so that it's attainable.
Okay, now that's cool because it made me think about my mom. And I think she's trying to learn Swahili now. So she's in her mid-60s. She's trying to learn Swahili now, and she likes romance novels and things. So she's always doing that. And so it's true, the more you use it, the stronger it gets, even with the brain. But the less you use it, the less stronger it could be, and the more susceptible you will be to memory disorders.
Right, absolutely. And reading, you brought up a great one that I didn't even mention. Reading is a fantastic way to keep your mind engaged.
Right. Okay. So we can't just sit around watching TV all day, every day, because it's not going to help our brain keep its plasticity. Okay.
Right, absolutely. Yeah.
All
So
right.
often people say, I earned my retirement. This is my time to relax. That's fine in moderation, but there's other things that are really important to consider for 10, 15, 20 years down the road.
Right. I guess the idea would be you can retire from work, but not from health.
Right. Absolutely.
Gotcha. Okay. So as far as TMH, Tallahassee Memorial Hospital, in the memory disorder clinic, so what processes? Okay, well, let me ask you like this: a person comes in and they're being diagnosed. So how do you all go about diagnosing that person with the specific memory disorder that they have?
Sure. So diagnosis of any kind of dementia is kind of like putting together a puzzle and ruling out those other potential causes of the problems they're experiencing. So the first appointment is going to be with the neurologist, and they'll interview the patient. We normally ask them to bring a family member for kind of that additional information I talked about changes and challenges that they've been experiencing over time. A little bit about their clinical history. Have they had a stroke in the past? Have they had heart problems? The doctor will usually do a brief mental status assessment just to kind of see where they're at on that day. And then they'll often refer to tests like MRIs, blood work, potentially sleep and hearing studies, or neuropsychological testing, which is another kind of component of our clinic. So it's about ruling out those reversible causes. Once the doctor has all of that information from those tests and referrals, they can generally inform a diagnosis. And then there are potentially some medications dependent on the stage and diagnosis that can slow the progression.
Right.
So the other really great thing about the memory disorder clinic is that we have our social work team. So it's myself and another social worker. We meet with every single patient at their first appointment and then offer the chance at follow-up appointments so that we can talk with them about, community resources, give them some education information on dementia and things like that. Kind of give some support. It's hard. It's a scary first step to take to go to that first doctor's appointment.
Yes.
So that's kind of what we're here for, is to and help them plan for the future too. So if they do have a diagnosis that's going to impact them, over the next few years, then we can kind of help them plan for that and be prepared both as the patient and their loved ones.
Right. And so without giving away all the secrets, because you mentioned medications, but what other forms of treatment do you provide for the patients who come in with memory disorders?
Oftentimes it's about kind of management. So we'll talk with the caregivers and the patient about kind of simplifying their routine if they do have a memory disorder. So, maintaining that good structured routine can really be helpful with the day-to-day functioning. Not a whole lot unexpected, kind of reducing stress and things like that. So you can kind of, even after you already do have a diagnosis, there are ways to manage it and make things a little more simple for the patient and their caregivers.
Okay. So yeah, because I'm guessing the idea is I have dementia, I have Alzheimer's. It's over. It's over. But there's a way that you can kind of fight it and prolong it to where it doesn't I guess the time frame isn't as short as somebody who would just allow it to happen.
So there are some medications that'll slow the process. I don't know that the things that the social work team helps with would necessarily prolong it, but it would certainly make things a little easier
I got you.
For the families.
I got you. And so just for my understanding,
sure.
Is there, I was looking at something the other day, and I can't remember the name of the medicine or who I was talking to, but it was something about a specific medicine that's given to a person to fight Alzheimer's that I think I was watching something that was talking about some biotech things, and they're giving some kind of injections that can help fight Alzheimer's. Have you heard of anything like that?
Yeah, so aducanumab, it's a pretty recent, it was just approved by the FDA, I think yesterday or the day before.
Okay.
They've been doing a lot of trials, and the goal of that medication, it's an intravenous medication, so people would get infusions of it, is to reduce the plaque in the brain.
Okay.
And they've done a lot of research to see if that can help slow the progression. So it can't necessarily reverse anything again, but the research was if it can help slow the progression. It has shown that it is effective in reducing the plaque.
Right.
So, I don't know when it will be available on the market, but if that's something someone is interested in, there are some tests to make sure that the person is a good fit for that medication. They could certainly talk with their doctor.
Right. Okay. Now this has been a good one. I'm enjoying myself with this. Trying to get you back on here. Yes, ma'am. So could you kind of give our audience an idea of the experience that they will have when they come into the memory disorder clinic and they come in to get treatment? What would the experience be like?
Sure. So we try and make it as painless as possible. They can be referred by their physician, or they can do a self-referral process, which they would be able to contact me for. I can assist them with that. The best email address is memorydisorderclinic@tmh.org. So
Okay.
pretty straightforward.
Right.
So once they're into the clinic, their first appointment would be with our neurologist. It would be about an hour long. So kind of talk about those things that I mentioned about the changes they've experienced, their clinical and medical history, a brief mental status exam, and then being referred, for those other tests. And then they would sit down and meet with the social work team. And we kind of do a brief needs assessment. So kind of see, how they're doing at home, what kind of things they might need help with. Often people, when they come in, they're so overwhelmed. They're just like, I don't really know what I need help with, or they've been functioning, as a family or on their own for so long that they just kind of don't really know what other options there are for that
Right.
assistance, whether it's emotional support, whether it's getting someone else in the home, things like that. And then we pick up from that part and provide whatever education, resources, support might be helpful.
Right. Okay. All right. That's pretty cool because I know we have a lot of clients and just a lot of people I know are afraid of the medical industry until they really need it. But
Mhm.
I want people to get out of the fear and be informed and educated about the different forms of medicine that they will need for treatment. So if you need to have something for your memory disorder, you need to be educated about it. Even if something like COVID vaccine, be educated about it because the narratives that we come across are very powerful, and we know how powerful propaganda and know how fast lies and mistruths spread versus the truth. So that's why we love what we do in this podcast. We get to talk to individuals like yourself who can give us the exact information versus, well, this is what I heard.
Mm-hmm.
So
It's
and
hard to know what's true and what's real, what's not. Even if someone just has questions, they're welcome to send me an email at that email address. I'm
yes.
always happy to answer any questions.
Okay. Okay. And so how can people, and could you repeat that email again and tell us how can people learn more about the TMH Memory Disorder Clinic and just TMH as a whole?
Sure. So our website is a really good resource at tmh.org/memory. That's how you
Okay.
get to the Memory Disorder Clinic website, or just tmh.org. We'll talk about the hospital in general. And then that email address again is memory disorder clinic at tmh.org.
Okay. And what's the best way for a person to get in contact with you? Somebody see this interview, they're like, she's brilliant. We have to have her talk to our people. How do they get in contact with you?
Yeah, absolutely. So they can send an email to that memory disorder clinic at tmh.org. I'm the only one that has access to that. Or they can send it directly to my email, which is sonnie.mayewski at tmh.org. So it's just my first name dot my last name at tmh.org.
Okay. I really appreciate you. Appreciate your time, the information, the effort. I just appreciate the passion and things that you give to the Tallahassee community. You being a fellow Tallahassean, I know you understand that we need as much help as possible. We need as many people hands in the fire working to help our community get better. And I appreciate that you care. You care at the end of the day. You want to see the people in your community get better. And thank you for that.
Absolutely. Thank you. Likewise to you guys. You guys do such phenomenal work with taking care of people and making sure people are aware of all these, really important things for our health.
Right. Yes, ma'am. So thank you. Thank you very much for being a part of our podcast. This is Mind Your Body. And so we're doing our best to make sure we are the number one health podcast in the world. So once again, people, Sonnie Mayweski, excuse me, Sonnie Mayewski. I said it wrong. Sonnie Mayewski with the Tallahassee Memory Disorder Clinic. And remember, this is Mind Your Body and Soul. This is an educational podcast that focuses on all things health related to help our listeners learn more about the various health topics that they may not have access to. We seek to empower, uplift, and mobilize our listeners to become the healthiest versions of themselves. Make sure you check out our website, www.nmcpodcast.com, or our parent website, www.neighborhoodmedicalcenter.org. You can find us on Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts, and of course, YouTube. Like, comment, subscribe, and share. With that being said, Sonnie Mayweski, you are the greatest. And thank you for being here. And we'll see everybody later.
Thank you so much.